means that you're actually starting to see changes in the breast. You can see the outline of the implant, and it's much harder. And then a grade 4 is the most severe, where you can see changes in the breast. It's hard and it's even painful at this point. So definitely grades 3 and 4 need to be treated. Grade 2, sometimes we can do watchful waiting for that. So first of all, the best thing to treat a capsular contracture is to never get one in the first place. So that's why we always talk about the techniques we use that decrease the risk for capsular contracture. So those include where we choose to make our incisions. So making the incision underneath the fold of the breast has a lower likelihood of developing a capsular contracture. Placing the implant either underneath the muscle or underneath the fascia just above the muscle, or just below the fascia and above the muscle are the 2 places where you're less likely to get a capsular contracture. Also, using a no-touch technique with the Keller funnel is the important thing that we do here at Pure Plastic Surgery. All these things combined decrease your lifetime risk of developing capsular contracture. Will likely place the implant in a new pocket below the muscle to decrease the risk of recurrence. So that's a brief overview of capsular contracture, one of the things we think about but always want to avoid with breast implant surgery. Do we have any questions on that?
There's a lot of new incomers, so there's repeated questions, but what are the common symptoms or signs of capsular contracture?
Capsular contracture, yes. So the typical signs and symptoms, so you start, the first thing you'll feel is that possibly your breast is getting a little firm, and that's when you want to call your surgeon and let him know so we can possibly start you on that medication. Next thing is you start to see the outline of the implant, and then third, you might even develop pain or anything like that. Those are all signs that you should get evaluated.
Perfect. You have one comment saying she is ready and she's ready to see you soon. So
Let's
most
do
likely
it.
will be
Looking
coming.
forward to meeting you.
And you have another fan from TikTok saying, I'm from Egypt and support you. Greetings, you are excellent and distinguished doctor.
Awesome. Thank you, sir.
So we do have a few people who are excited to see you. Now, another question I have, are there any non-surgical methods to manage capsular contracture?
Yeah, so actually what I mentioned, that medication, that allergy medication, Singular, it's a leukotriene inhibitor, and the thought process behind this is it's going to limit your body's response to this foreign object, and it's going to decrease your body's response to capsuling off or scarring off this breast implant. And so that's the only non-surgical option we have, besides also doing massage, is suggested to decrease the risk of capsular contracture, but that's kind of disputed.
Okay, next question is, can capsular contracture recur after treatment, and if so, what can be done?
Yes, it can happen. It can recur after treatment. That's why we have to be thoughtful about how we're going to treat it. And one of the biggest things we can do for decreasing that risk of recurrence is either taking all the capsule out or relocating the pocket where the new implant is going to be going. So if it was above the gland, we can put it underneath the muscle. If it was underneath the muscle, we can possibly do a subfascial pocket dissection.
Okay. And another question is, how long does it typically take for capsular contracture to develop after breast implant surgery?
So it can happen anywhere from a few weeks to many years down the road. So, typically the most common time that it can happen and we can do something to treat it early is the first few months after breast augmentation. That's why you need to be in communication with your surgeon. But it can happen years down the line as well. And we have yet to have data on our most current techniques about what the risk of lifetime capsular contracture is, but it's been going lower and lower as we improve our techniques and the implants and other things that we use.
Okay. Talking about the capsular contracture, can it happen with any type of implant, like silicone, saline?
Yes, it can. So there's really no difference between silicone or saline smooth implants. That was actually one of the advantages of the textured implants that we no longer really use because of the risk of breast implant associated ALCL. But textured implants had a slightly lower risk of capsular contracture than these smooth implants.
Okay, and is there any tips you want to add on to the topic for anyone that's new to it, that's capsular?
Yeah, if you have any concerns that you might have one, go see a plastic surgeon, get evaluated. Because like we said, if it's early, there are some things we can do to stop the progression, or it may just be time to get imaging done to make sure you don't have a ruptured implant or anything like that. But you need to talk to a board certified plastic surgeon and go from there.
All right, thank you so much, Dr. G.
All
Dr.
right, everybody
Gatorade.
have a great day.
You had